Louisa, what are the specific considerations for the elderly?
The elderly can suffer, as everybody else can, with all the disorders that we've been talking about in this series, with BPPV, with vestibular migraine, with Meniere's disease, anything else that we've already talked about. The challenge with the elderly, and I think GPs will recognise this from their practice, is that they tend to present in fairly atypical ways. So their perception of movement and dizziness is quite different, so that they will frequently not describe vertigo in a way that you will easily recognise that they're describing BPPV or another vestibular disorder, which means that we're much more dependent on physical examination findings in patients, in elderly patients, to pick up those sorts of conditions. BPPV is increasingly common with age. So in any dizzy elderly patient, it is particularly important to do a positioning test to pick that up. And it's treatable, of course. The other thing with elderly patients is that they frequently have multiple causes for their dizziness, and it can be contributed to by any part of the balance system. So we have vestibular disorders that we've been talking about, but also visual problems, somatosensory problems from their diabetic neuropathy, and also the brain that integrates all this information. If they have small vessel disease or other central neurological disorders, that they are at increased risk of reporting disequilibrium and balance problems. So it can frequently be a case of a number of relatively minor problems adding up to being.
So how can we unravel this?
I think using quite a systematic approach to the physical examination, looking at the ECG, the gait, the Dix-Hallpike test, and considering all the different parts of the balance system in order. So looking at visual function, looking at proprioceptive function, looking at musculoskeletal function, and cognitive and neurological function.
It's difficult to be done in the 10 minutes consultation.
It is.
So is there any things that you think we ought to do in all patients coming in with poor balance, and who else could help us?
Again, the top answer has got to be the Dix-Hallpike or the positioning test to pick up BPPV, because it is something that is common and treatable. It's also important to do the gait examination that we talked about, which is very revealing and can guide you towards